Okay, so ventilation we're going to concentrate on right now. We'll get to respiration in a little bit. Ventilation is the mechanical process of drawing air in and out of the lungs. It can be broken down into two different processes or two different, what do you call it? Ventilatory processes. Overall, there's the mechanical process and then there's alveolar ventilation, which is actually a part of the mechanical process. However, it has a few little different measurements within it to measure how much ventilation the alveoli are having. But we'll discuss that in a minute. Just wanted to know that it was there and we'll discuss it. So mechanical ventilation. Mechanical ventilation is two different phases. We have equals the active phase and the passive phase. So we'll discuss the active phase first. So the active phase is when the diaphragm contracts. So the diaphragm is going to move down. It's going to contract. So that is going to move down. The diaphragm is in a bell shape. It is going to flatten out, opening or creating a larger area. That alone is going to create a larger area within the thoracic cavity to create a lower pressure. At the same time, the intercostal muscles are going to contract and they are going to pull the ribs up and out. So the whole chest cavity is going to expand, creating a larger volume, which thus creates a lower pressure than the outside area, than the outside air, which is going to cause air or gas, depending on how you want to look at it, to rush in through the mouth and nose, through the upper airway, down into the lower airways, and ultimately into the lungs. So again, during the active phase, the diaphragm and intercostal muscles contract. The diaphragm flattens. Intercostals pull up and out, creating a larger volume and lower pressure within the lungs, causing air to rush in. Pretty simple, pretty easy. It's a very complicated process with a very easy description. So that's all well and good. So we take all that and we take our big breath in. And if you think about, we do this without thinking. We breathe, we ventilate without even thinking about it on an everyday basis. We do it 10 to 12 times a minute at rest. Faster when we're under stress or working out or in times of need where the body has an increased oxygen demand. We can increase our respiratory rate. We can voluntarily increase our respiratory rate. We can breathe faster on our own if we want to. We can slow ourselves down if we want to. But it is also autonomic, and it will take over for what the body will take over, whatever it needs. It's like the little kid that gets mad and holds their breath until they pass out. Let them. They'll pass out, and they will start to breathe again because the body is protecting itself, and it will take over. It's scary the first time it happens, but they've been doing it for a very long time, as long as we've been having kids. Just a little side note. Okay, now let's talk about the passive phase. Passive phase of ventilation is exactly what it is. It's passive. There's no active part in it, or very little active part in the process, this process of ventilation. It's the exhalation. So active is inhalation. Passive is exhalation. Inhale, exhale. So passive phase, exhale. So what happens in the passive phase? The diaphragm and intercostals relax. The elastic nature of the lungs and the muscles and the tissues within the thoracic cavity spring back to normal shape. And air is forced out. So now, with that all happening, all this goes backwards. So we erase our little downward and outward arrows. And we replace them with upward and inward arrows. And the diaphragm goes back. The chest wall goes back. And air now exits the body. All of this creates a high pressure So air is forced out of the lungs due to higher pressure in the lungs than outside. So during the active phase, when all of this is expanding and getting bigger, you're creating a lower pressure. So inhalation is low pressure. Low pressure, creating air going into the lungs, going back in through the airway and down into the lungs. Exhalation is creating a high pressure, forcing air out of the lungs. Now, there are a multitude of problems that can come from this, or that can interrupt this process. But for right now, we just need to understand the active process of expanding the chest cavity, expanding the thoracic cavity, and lowering the pressure within the lungs to draw air in is an active process by which the diaphragm contracts, the intercostal muscles contract and open that airway up, forcing air or drawing air in through the mouth and nose, through the upper airway into the lower airway, ultimately into the lungs. The passive phase or exhalation is when all those muscles relax. The spring-like nature of the lung parenchyma or the lung tissue, the intercostal muscles and the diaphragm in their relaxed state, pulling back in, tightening back up, increasing pressure within those lungs, forcing air back out of the lungs, out through the lower airway, up out through the upper airway, and then out through the mouth and nose, out into the lower pressure of the environment. That is one cycle or one complete respiration.